Hello, I'm Dr. Robert Guida, and I'm here to tell you about sinusitis and its potential complications. Sinusitis is inflammation of the lining of the sinus cavities in the nose. The sinuses are air-filled cavities in the skull which are connected to the nose. They have a lining containing mucus glands which secretes mucus to help clean the nasal airway. Sinusitis is common, affecting about 5 to 10% of the adult population each year. These linings can become inflamed by viruses, like in a common cold, or by a bacteria or a fungus, or they can become inflamed by allergies. The main symptoms of a sinus infection are a stuffy nose, thick nasal drainage, and facial pain or pressure. Most sinus infections are caused by a virus, like in a common cold, and go away on their own in about 7 to 10 days. The drainage from a sinus infection from a virus is kind of clear and not a yellow or green color. However, 2 to 4% of sinus infections can be caused by a bacteria, which require antibiotic therapy. The drainage with a bacterial sinus infection is a thicker yellowish green color. The symptoms may last from 10 to 14 days. Acute sinusitis means the infection goes away in about 7 to 10 days with antibiotic therapy. Chronic sinusitis, however, means the infection can last 2 to 3 weeks. Even after therapy, it can recur 7 to 12 times a year. Chronic sinusitis can be a serious problem and may need surgical drainage. Although complications of sinusitis are very rare, life-threatening complications can occur. Recently in Florida, a young boy was complaining to his mother that he had blurred vision, a bad headache, and a stuffy nose. His mother took him to an emergency room and several doctors, and they told him to go home and rest. But the mother was persistent because she saw her son becoming tired and the pain getting worse. They went to a nose doctor who obtained a CT scan, which showed a very serious sinus infection which has spread into the brain. The boy required a craniotomy to drain the infection, and this saved the boy's life. Closer to home, a few years ago, my mother developed a bad sinus infection. She had pain around the eye, yellow drainage out of her nose, and a bad headache. She went to see the eye doctor because of blurred vision, and he told her to relax, go home, and use warm soaks. 3 or 4 days later, the eye started to protrude out of the eye socket, and the drainage got much worse. I sent her to Pittsburgh Eye and Ear Hospital, and she was seen by a nose doctor that got a CAT scan. Here's a copy of the CAT scan. It shows an abscess in the sinus cavity, pushing the eyeball out of the eye socket and about to spread into the brain. She required surgery with an ear, nose, and throat doctor, an ophthalmologist, and a neurosurgeon. They drained the sinus infection, they drained the infection in the eye, and they prevented it from going into the brain. Because of the antibiotic therapy, the surgical treatment, and my mother's persistence, she was able to get rid of the sinus infection, and it literally saved her life. This is a potentially serious complication of chronic sinusitis. How does this happen? How does an infection get from the bony walls of the sinuses into the brain or the eye? There are small blood vessels from the sinuses that communicate to the eye and to the brain, and sometimes bacteria can spread from the sinus cavity through those little blood vessels and into the cranial cavity and orbit, causing these infections. You can get symptoms of a very bad headache, redness or swelling around the eye, pain when moving the eye, and possibly even a seizure disorder. If anyone develops these kind of symptoms, they need to see an ear, nose, and throat doctor and consider getting a CT scan right away. When complications arise like this, surgical drainage with image-guided surgery is necessary. A team approach with an ear, nose, and throat doctor, an eye doctor, and possibly a neurosurgeon is needed to drain the infection and also give the patient antibiotic therapy. Here you can see me performing surgery on a patient with a sinus infection that spread around the eye and very close to the brain. You can see the yellow pus being drained from the sinus cavity, which will help to successfully treat this life-threatening infection. Once the infection is properly drained and the underlying causes of the sinus infections are treated, the success rate is quite high as well as life-saving.